All right, everybody, welcome back to Let's Talk About Sleep, the channel where we talk about sleep. The book, the link will be in the description box as always. And as always, these videos are for educational purposes only, so if they inspire you to think about things differently, certainly talk to your provider about them, about them. Good to see you all again. Today, what we're going to be talking about is another treatment for sleep apnea. So, sleep apnea, again, situation where the airway back here, back behind the tongue, closes off throughout the night, right? Obstructive sleep apnea. So, apnea means stoppages of breathing. Obstruction back here as the tongue falls backwards and closes off the airway. Okay. And from the other videos, we talked about CPAP, right? How is CPAP working? Continuous positive airway pressure, basically just pressurized air coming in, going all the way down to the back of the throat, forcing the airway open. So those obstructions can't happen. Okay, good. But what about something called APAP or AutoPAP or auto-adjusting CPAP or auto-adjusting positive airway pressure, right? APAP, you may see. There's definitely a lot about them on the internet, and I get asked a lot about this myself in my practice. So what are they? So CPAP is continuous positive airway pressure, right? So what that means is that there's one stream of air coming in, going all the way down to the back of the throat, forces the airway open, okay? Auto-adjusting PAP is the same idea, but in this situation, the pressure that comes in, it's not one continuous stream. I mean, it's a continuous stream, but the setting, the level changes over the course of a night. Okay, so what happens is, let's say, for example, somebody, you may remember from some of the other videos, if somebody's on their back, right? If somebody's flat on their back, what's happening is gravity is pulling the tongue towards the back of the throat more. Okay, so sleep apnea tends to be worse when somebody's on their back, right? So let's just say, for argument's sake, that somebody really has a severe case on their back, and when they're on their side, it's not so bad, right? Sleep apnea, I mean. So in that case, sure, CPAP could be used, and the pressurized air will be whatever it is, and it may be on the higher side because it has to account when the person spends time on their back. An AutoPAP or an APAP, what that's going to do is that's going to be set by a provider, by a doctor or whoever, that there's going to be a range of pressures, right? So, for example, if somebody spends time on their side throughout the night, the pressure is going to be low. And the machine is kind of like a smart machine. It can tell, okay, if this person has gone onto their back, they're starting to have more apneas, the pressure is going to go up. Okay, so all throughout the night, the pressure change is going to be evident. Not so much that the patient will necessarily know what's going on, they'll be asleep, but the pressure will go up and down depending on what's happening. These can be very useful, as you can imagine, but they also have problems, okay? These days, most of the testing that we're doing is home tests, right? And that's basically just because of insurance companies. So what happens is we don't have the luxury of having somebody come in overnight, finding out what their level of sleep apnea is, sleep overnight at our center, find out what their level of sleep apnea is, then do a full night study with a CPAP machine on to figure out what the right setting for them is. In most cases, what we'll do is we'll prescribe an APAP, an auto-adjusting machine, which will kind of take care of all those problems, okay? Insurances do cover them the same way that they cover CPAP, but if somebody were to just buy them outright, they're a little bit more expensive. And there can be issues, okay, with the ramping up of pressure, for example, that can cause leakage, that can make the patient uncomfortable, that can be jarring in some cases, okay, so something to be aware of. And you really can't use APAP in certain other conditions. So if somebody has, like, for example, sleep apnea and COPD, it's really not recommended in those situations, okay? So definitely conversations to have with your provider, but just to know what it is out there. But ultimately, what happens is the technology is essentially the same thing, right? It's just pressurized air coming in. The range, if you will, changes. If it's CPAP, it's going to be one setting, so it's not going to be a range. With an APAP, there is going to be a range, okay, and that gets set by the provider. Okay, so that's basically the difference between the two of them. there's other bells and whistles that can come on and certainly are advertised about, but essentially that's the difference. Okay, so just so you know, that's the end of this video. Okay, so if you have questions, please leave them in the comment section. What I'm going to be doing going forward is once a month making like a question answer from the previous month's questions, either on Instagram, which is Daniel Barone MD, or my or Twitter, or Facebook, or YouTube. Let's talk about sleep. All right. If you like this video, please click like. Please subscribe to the channel. Okay, it helps me out. We're trying to get to 1,000 subscribers. Once we do, I will send out a signed copy of my book to some lucky viewer. Until next time, sleep well.